Good day, everyone. So today we're gonna do some Q&A questions about foundations of care. Okay, let's start. Question number 1. A client being measured for crutches asks the nurse why the crutches cannot rest up underneath the arm for extra support. The nurse responds knowing that which most likely result from this improper crutch measurement. A fall and further injury. B. Injury to the brachial plexus nerves. C. Skin breakdown in the area of the axilla. Or D. Impaired range of motion while the client ambulates. Correct answer is B. Injury to the brachial plexus nerves. Question number 2. The nurse has given the client instructions about crutch safety. Which statements indicate that the client understands the instructions? Select all that apply. A. I should not use someone else's crutch. B. I need to remove any scatter rugs at home. C. I can use crutch tips even when they are wet. D. I need to have spare crutches and tips available. Or E. When I'm using the crutches, my arms need to be completely straight. Correct answers are A, B, and D. I should not use someone else's crutches. I need to remove any scatter rugs at home, and I need to have spare crutches and tips available. Question number 3. The staff nurse reviews the nursing documentation in a client's chart and notes that the wound care nurse has documented that the client has a stage 2 pressure injury in the sacral area. Which finding would the nurse expect to note an assessment of the client's sacral area? A. Intact skin. B. Full thickness skin loss. C. Exposed bone, tendon, or muscle. Or D. Partial thickness skin loss with exposed dermis. Correct answer is D. Partial thickness skin loss with exposed dermis. Question number 4. The nurse is performing a skin assessment on the client and notes an area of full thickness loss of skin on the sacrum. Adipose tissue and granulation tissue are present with no visible muscle, tendon, ligament, cartilage, or bone. How would the nurse classify this pressure injury? A. Stage 1 pressure injury. B. Stage 2 pressure injury. C. Stage 3 pressure injury. Or D. Stage 4 pressure injury. Correct answer is C. Stage 3 pressure injury. Okay, our last question for part 1. Number 5. The nurse is preparing to provide a wound care to a client with a stage 1 pressure injury. Which dressing would the nurse expect to be prescribed in the treatment of this wound? A. Hydrogel dressing. B. Transparent dressing. C. Antimicrobial dressing. Or D. Calcium alginate dressing. Correct answer is B. Transparent dressing. That's it, guys. If you like the video, I would appreciate if you can hit the thumbs up button. Also, if you want to subscribe, then you can see my other videos. Thank you.